Did you know that 67% of seniors over 65 misunderstand at least one aspect of their medical diagnosis or treatment plan when they leave their doctor's office? Here's what's even more alarming. A study published in the Journal of General Internal Medicine found that medication errors due to poor health literacy contribute to over 7,000 deaths annually among older adults in the United States alone. You deserve to understand your own body. You deserve to know what your doctor means when they use medical terms. You deserve access to the same clear, reliable medical education that healthcare professionals use. Today, I'm taking you inside a platform that's changing medical education, and it could change how you understand and manage your health for the rest of your life. The platform we're exploring today, Zero to Finals, was created by Dr. Tom Blackwell, a practicing NHS general practitioner in the United Kingdom with over 12 years of clinical experience. Dr. Blackwell has treated more than 15,000 patients and noticed a critical gap. Even intelligent, educated people struggled to understand their medical conditions because the information was either too complex, too scattered, or simply unreliable. So he built something different. Zero to Finals has helped over 300,000 medical students and healthcare professionals pass their exams and become better clinicians. But here's what matters to you. The same clear, evidence-based medical explanations that train doctors can help you understand your own health conditions, heart disease, diabetes, arthritis, dementia risk factors, in plain English, backed by real science. This isn't Dr. Google. This is doctor-created, medically accurate education designed for clarity. Here's what happens when you don't understand your health. Medical research from Johns Hopkins University shows that poor health literacy directly correlates with 52% higher risk of hospitalization, twice the risk of medication errors, and 3 to 4 years shorter life expectancy. Why? Because when you don't understand the warning signs of a stroke, you delay calling emergency services. When you don't understand why your blood pressure medication timing matters, you take it inconsistently. When you don't understand how prediabetes progresses, you miss the window to reverse it naturally. Your brain needs structured, reliable information to make life-saving decisions. Random internet searches give you fragments. Social media gives you opinions. You need systematic, medically reviewed education. That's exactly what a proper medical education platform provides, and that's what we're touring today. Mistake number 1, trusting random health websites. Scientific danger. A study in JAMA Internal Medicine found that 72% of health websites contain inaccurate or outdated medical information. For seniors researching conditions like atrial fibrillation or osteoporosis, this misinformation can lead to dangerous self-treatment decisions. Surprising data. Research shows that 1 in 3 seniors who self-diagnose using unreliable internet sources delay seeking proper medical care, increasing their risk of complications by 40%. Patient story. Meredith, 68, read online that she could cure her high cholesterol with cinnamon supplements alone. She stopped her statin medication without telling her doctor. 6 months later, she suffered a minor stroke. Her cardiologist later explained that while cinnamon has mild benefits, it could never replace proven medication for her risk level. Reliable medical education would have prevented this. Mistake number 2, relying only on 10-minute doctor appointments. Scientific danger. The average primary care appointment lasts just 18 minutes, but doctors must address multiple concerns, prescribe medications, and document everything. There's simply no time for thorough patient education on complex conditions. Surprising data. A BMJ study found that 76% of seniors leave medical appointments with unanswered questions about their diagnosis or treatment plan, but only 22% follow up to get clarification. Patient story. Robert, 71, was diagnosed with early-stage chronic kidney disease. His doctor mentioned watching his protein intake, but didn't have time to explain why or how much. Robert searched online, found conflicting advice, and accidentally worsened his condition by eating too little protein, causing muscle loss. Structured medical education would have given him the complete picture. Mistake number 3. avoiding medical terms instead of learning them. Scientific danger. When you don't understand terms like systolic pressure, HbA1c, or ejection fraction, you can't truly participate in your own healthcare decisions. This passive approach is linked to worse health outcomes across every major disease category. Surprising data. Research from the American Journal of Preventative Medicine shows that seniors with higher health literacy have 30% better medication adherence and 25% fewer emergency room visits. Patient story. Linda, 66, heard her doctor say she had reduced ejection fraction. She didn't ask what it meant and went home terrified, assuming it was a death sentence. 3 anxious weeks later, at a follow-up, she learned it simply meant her heart wasn't pumping as efficiently, a manageable condition with lifestyle changes and medication. Understanding the terminology from the start would have saved her weeks of unnecessary fear. Let me show you how a proper medical education platform solves all 3 of these problems. Solution number 1, medically reviewed, organized content. Scientific benefit. Instead of scattered, unreliable internet searches, you get content reviewed by practicing physicians and organized by body system, cardiovascular, respiratory, endocrine, musculoskeletal, and more. Every article follows the same evidence-based structure: what the condition is, what causes it, how it's diagnosed, how it's treated, what you can do to prevent it or manage it. Successful study data. Platforms using this systematic approach have shown 89% user comprehension rates compared to just 34% for standard web searches. Specific action plan. When your doctor mentions a new diagnosis, let's say atrial fibrillation, you can log into the platform that evening, type it into the search bar, and read a clear 10-minute explanation written at a level you can understand. You'll learn why your heart rhythm matters, what stroke risk really means, why blood thinners work, which lifestyle changes matter most. You walk into your next appointment informed, empowered, and ready to ask intelligent questions. Solution number 2, learn at your own pace. Scientific benefit. Unlike rushed medical appointments, quality medical education platforms let you revisit complex topics as many times as needed. Repetition and self-paced learning improve retention by 70% compared to one-time verbal explanations. Successful study data. Research published in Medical Education Online found that patients who used structured medical education resources showed 42% better disease management within 6 months. Specific action plan. After a diagnosis, spend 20 minutes per day for 1 week learning about your condition. Day 1, read the overview article. Day 2, watch the video explanation. Day 3, review the diagnostic criteria. Day 4, study the treatment options. Day 5, learn the prevention strategies. Day 6, learn medication mechanisms. Day 7, prepare questions for your doctor. This systematic approach transforms you from a passive patient into an active partner in your healthcare. Solution number 3, master the medical language. Scientific benefit. When you understand medical terminology, you can accurately describe symptoms, understand test results, and recognize warning signs early, potentially saving your life. Successful study data. A health affairs study showed that seniors with higher medical literacy had 60% fewer medication errors and were 3 times more likely to catch serious symptoms early. Specific action plan. Create your personal medical glossary. Every time you encounter a new term from your doctor, look it up on a reliable platform. Write it down in a notebook with the simple definition. Review your glossary before medical appointments. Share it with family members who attend appointments with you. Within 3 months, you'll understand 90% of what your doctors say, transforming anxiety into confidence. If you're finding this valuable, if you want more content that helps you understand your health, make better medical decisions, and maintain your independence, do 3 things right now. First, hit that like button. It tells me that clear, medically accurate health education matters to you. Second, subscribe to this channel and ring that notification bell. We're dedicated to bringing you senior health content that's evidence-based, understandable, and actionable. Third, comment below with your age and the health topic you'd most like to understand better. I read every comment and use your feedback to create future videos. This channel exists to help you take control of your health in your 60s, 70s, 80s, and beyond. Let's continue. Here's what's possible when you have access to clear, reliable medical education. You walk into your doctor's office as a partner, not a passive recipient of orders you don't understand. You catch warning signs early. Maybe you recognize the symptoms of a mini-stroke and get to the emergency room within the critical 3-hour window. You ask the right questions about medication side effects and avoid dangerous drug interactions. You understand why your blood sugar matters, why strength training prevents falls, why sleep affects your dementia risk. Studies show that seniors with higher health literacy spend $3,000 annually on medical costs, have 25% fewer hospital admissions, maintain independence 4 to 6 years longer, and report significantly higher quality of life. This isn't just about living longer, it's about living better. It's about dignity. It's about not being afraid every time you feel a new symptom.